su akali da abincin su kama har zuwa ruwan da suke sha su duba da makwancin su daga za ka gane mugun jagora sassabar wuce kan zaɓen jagora sannan ba sa alkunya daga an doka tamburin da na siyasa ya ba tsoron Allah sun yi oda ta a tambarin sosa sun bambam da gumakan su sun rarraba a mulki sun oda sauri ke so sassaucin duk sassawa amma kai aka kaiwa karar duk mai cutarwa koke aka yi na kaiwa shugaba mai cutarwa ka tsare talakawa kai muke sujadawa sauyin sauri ke so sassaucin duk sassawa a zabuta da bakawa ƙarar kuka da tsoro
Distinguished guests, ladies and gentlemen, students, once again, you're welcome to this auspicious occasion, the second career lecture of Human Kinetics and Health Education, organized by the Department of Human Kinetics and Health Education, Faculty of Education, Ahmadu Bello, University, Zaria. And ladies and gentlemen, already seated on the high table is the Vice Chancellor of Ahmadu Bello University, Zaria, Professor Adamu Ahmed, who is here ably represented by the Deputy Vice Chancellor Academic, Professor Raymond Bako. Please let's put Chancellor. Thank you very much. And then also, ladies and gentlemen, we have the Commandant General of the Nigerian Security and Civil Defense Corps, NSCDC, Dr. Ahmed Abubakar Audi MNI, who is here ably represented by the Corps Commandant, Kaduna Command, NSCDC, Bello Nuhu Dansadawu. You're welcome, sir. May I also recognize at the same time invite to the high table the Medical Director of Federal Medical Center, Abuja, Professor Saad A. Ahmed, who is here ably represented by the Deputy Director, Directorate of Academic Planning and Monitoring, Professor Abdulaziz Hassan. Please can we put our hands together for him? Also, distinguished ladies and gentlemen, our guest speaker, or rather one of our guest speakers for today, the Director of Federal Capital Territory Secondary Education Board, Abuja, Nigeria, Dr. Mohammed Sani Laden. You're welcome, sir. May I also acknowledge, at the same time invite to the high table, the hosts of today's, or rather the co-host of today's event, the Dean, Faculty of Education, Professor Abdullahi Al-Hatu, who is here ably represented by the Deputy Dean, Dr. Nuruddin Shehun Akorede. Our second guest speaker, the Managing Director, Kaduna State Environmental Protection Authority, Dr. Yusuf Yakubu Arigasiyu. You're welcome, sir. Please, let's put our hands together. represented by Major, one-time staff of the Department of Human Kinetics Education. Eventually, he left and now back on sabbatical to the department. The person of Professor A.G. Suleiman. Please, can we put our hands together for Prof? The representative of the Chief Security Officer of Ahmadu Bello University, Zaria, Malam Abubakar Kabir, DMU. You're welcome, sir. May I also invite the principal, Demonstration Secondary School, Ahmadu Bello University, Zaria, Dr. A.A.B. Also, ladies and gentlemen, the coordinator of this great event, Dr. Ahmad Sani Geso. Please, can we put our hands together for him? Alhaji Al-Qasim of the Department of Medicine, you're welcome. And all other invited guests, distinguished ladies and gentlemen, members of the press, students, you all are welcome. And ladies and gentlemen, each time we find ourselves in a gathering like this, it is very important that we seek divine intervention. And based on our tradition here in Ahmadu Bello University Zaria, we give ourselves 30 seconds to pray according to individual faith. May we take 30 seconds to pray, please. Amen. Amen. Next is the national anthem. May we all rise for the national anthem, please.
Nigeria, we hail thee, our own dear for the brotherhood we stand. Nigerians all are proud to set our sovereign motherland. Our flag shall be a symbol that truth and justice reign. Oh God, to honor and this we can't escape. To hang on to our children, our banner without stay. Oh God of all creation, grant these our one request. Help us to build a nation when no man is oppressed, and so with peace and plenty, Nigeria may be blessed.
The ABU anthem, the ABU anthem.
As now we proclaim, from hills and valleys we come to knowledge our duty in learning and service. Excellence is our goal. Ahmadu Bello University, yeah, our dreams we shall achieve. We give thanks to Almighty Allah, in Him we derive our strength. We beautifully shall have them, and the ways of good learning. North to south, east to west, your name shall always be. Ahmadu Bello University, a citadel of great learning.
Thank you very much. You may all sit down. You know, I was surprised when I saw the national anthem. But then I realized that everything was projected here on the screen. Thank you. The Vice Chancellor, sir, the chairperson of today's occasion. Quickly before we call, or rather, item on the agenda, may I also acknowledge the presence of all senior officers of the NSCDC, the deputy commandant, the assistant commandant, the divisional officer of Savangari, all other senior officers of the NSCDC. You all are welcome. Your presence is acknowledged and well appreciated. Thank you very much for coming. Now, ladies and gentlemen, I have the singular honor and privilege to invite for the welcome address the head of Department of Human Kinetics and Health Education, Dr. Suleiman Usman Omeza. Please, let's put our hands together for the HOD while he comes for the opening, for the welcome address.
Thank you very much. My VC, sir, please permit me to stand on the already established protocol. It is a great pleasure and honor to address you all today as we come together to explore the diverse career opportunities within the field of human kinetics and health education. Today's gathering reflects our shared commitment to guiding our students not only in the academic excellence, but also to make informed decisions about their professional opportunities. We are privileged here today with us range seasoned and expert professionals from various sectors, including sports science, health education, physiotherapists, name it all. Today, our students, I encourage you all to actively participate, ask questions, and you'll be fully informed of all the opportunities that awaits you. Please take this opportunity and never be left behind. Our VCs are ably represented by our own from the Faculty of Education, Professor Raymond Baku. I want to inform you here today that all our beloved students you see here today, we are eager to come and see the People's VC, whom you are ably representing. They were wondering when we told them in the department that he plays active basketball. He said, wow, is there any other VC in Nigeria that does that? Thank you. Our VCs are ably represented by Professor Raymond Baku, our DVC. Please be informed, sir, that the Department of Human Kinetics and are so united between the staffs and students. And that's why you can see the mass turnout to come and grace this occasion. We thank you for coming to us, sir. The department is among those, if not the only one, that has been spreading the gospel of the good name of Ahmadu Bello University for the past 6 years. How do I mean, sir? Within the health education unit, there's what we call outreach. This year alone, our students visited correctional center, helped them in sanitation programs. They visited orphanage homes, donated items, helped them in the sanitation programs. And I can assure you here that every nook and corner of Zaria, both the wards and the villages have been visited by our beloved students. From the human kinetic level, sir, be informed that every primary and secondary school within Zaria metropolis, in and out, are equipped with teaching aids that has to do with physical activities, just to encourage them for them to know the benefits of this program. And I assure you that in most cases, every opportunity we have, we dare to propagate the good image of Ahmadu Bello University. Culturally, you will see our students here today from Human Kinetics and Health Education will display a list of the courses they are taught within the department to integrate all of them from wherever you think you come from. We make sure they live Human Kinetics and Health Education under ABU as one united family. I will not leave here my VC, sir, without mentioning one or two of our colleagues who have helped in putting this occasion to the best of their knowledge. Dr. A.S. Gezo, please thank you for organizing this program for us. Professor J.A. Gwani, Professor Umaru Musa, Professor M.A. Suleiman, we want to sincerely thank you for your sleepless nights, correcting our manuscripts and making sure we do just the right thing. I want to sincerely thank all our staffs, both the professors and others who tirelessly helped us in putting up this wonderful occasion. Once again, thank you all for being here, and I wish you all a fruitful and powerful session. God bless you all.
Please, you can do better for the HOD. Thank you very much, HOD, sir. And now, distinguished ladies and gentlemen, I have the singular honor and privilege to invite to the podium the chairperson of today's event. The chairperson of today's event also doubles as the National President of the National Association of Physical Health Education, Recreation, Sport. Please join me in welcoming Professor Florence Bola Adiyanju.
Good morning, everyone. Human Kinetics and Health Education students. How great you are. Shout and let me hear you. I'm glad to be here representing NAFA SD and also the founder of Nigeria Association of Women in Sport. The Vice Chancellor, ably represented by our own professor in education, Educational Foundation, Professor Raymond Bako. You are welcome, please. Glad to have you here. I know in those days, you people used to call us the oncologists. Well, I'm glad you know better now that we are beyond the oncologists. Please, I cannot name each and everybody here because it will take a long time. So I will stand on the existing protocol. Please permit me to do that. I just want to appreciate the department who groomed, where I was groomed. I was like you between 1978 and 1980 as undergraduate student. Then you realize that physical and health education was not popular. It wasn't popular because it was underrated. And people didn't actually know the significance in the nation, in Africa, and all over the world. Human kinetics and health education. So I stand here on behalf of our profession. Physical, health education, recreation, Sport and Dance as the national president, and being the first female president of that profession, established since 1966. I bring greetings to all of you. I bring greetings to all the departments, all the segments of our profession. And like I said before, if you look at the reading, physical, health education, recreation, sport, and dance, we are all over and we are all united. We are selling, we are being marketable. And so, please, on behalf of NAFA SD, listen very well. Listen very well. You can pick one or two things. Gone are the days that we were jumpologists. The way we fly now is more than jumping and running. The moment you listen, you acquire knowledge. You get there. Before you know it, in the combination of the departments where we have, you will not lack job. You will not lack job. Remember now, if our people go out, we play soccer. Those who are depressed, the moment they are there on the field or on the screen, everybody becomes cheerful. Anywhere you go, you are sellable. And so please listen to the different career opportunities that we have in this field. Put it down, take note, be able to analyze, and by the time you graduate here, you will be better than us by the grace of God. And so on behalf of NAFA SD, I welcome you as the chairperson of this program to this program. Please stay tuned. May God bless you all.
Thank you. Thank you. Thank you. Thank you, comrade. Thank you, thank you. Thank you, emergency agency. Thank you. Well, thank you very much, Prof. Ma. And ladies and gentlemen, quickly we move to the next item on the agenda. And the next item on the agenda is the remarks by the chief host of today's event, the Vice Chancellor of the prestigious Ahmadu Bello University, Zaria, Professor Adamu Ahmed, who is here ably represented by the Deputy Vice Chancellor Academic, Professor Raymond Bako. Please let's put our hands together for the Vice Chancellor while he comes for his remarks.
Thank you very much for the bossas. I say bossa back to you. The chairperson of this occasion, Professor Florence Adeju, the head of department, distinguished speakers that have been invited, high-level invited guests, distinguished professors our great students, invited ladies and gentlemen, good morning. On behalf of the Vice Chancellor, Professor Adam Mohamed, I want to welcome you to this very important occasion. Just before arriving here, the Vice Chancellor came into the office and I went to see him. He returned this morning or yesterday night from Morocco. You have been told that your Vice Chancellor is a sportsman. And so if I said he returned from Morocco, you know what he went to do. So he sends his warm greetings to this gathering. And he has asked me to appreciate the Department of Human Kinetics and Health Education for organizing this lecture series, the second. And in particular, the focus of this lecture series, exploring opportunities in human kinetics and health education. Again, like you have been told, as a Deputy Vice Chancellor Academic, I've been in the Faculty of Education, and I've been closely related to all of the staff and students in the Department of Kinetics and Health Education. Over the years, the perception about physical and health education has changed. And that necessitated the department to rebrand itself to Human Kinetics and Health Education. There is a growing demand in the world in sports. And therefore, the department has found it necessary to continue to sensitize the Nigerian public and prospective students about the career prospects and the opportunities inherent in studying human kinetics and health education. I can assure you, for those of you who are students of human kinetics and health education, that you have chosen the right path for your life. There are so many opportunities that are out there that if you focus, you acquire the right skills and the right bodies of knowledge, that you will be able to excel, not only locally, but internationally. The university stands behind the department and all other departments and units of the university who are rebranding themselves, who are looking beyond service and looking at possibilities of resource mobilization. And the university will continue to partner and support these units to achieve their goals. As a university, we will continue to strive for excellence in everything that we do. We will continue to ensure that we provide an enabling environment for our students to thrive. Therefore, you can be rest assured assistance behind our departments and our faculties, and the university stands behind our students as you try to develop yourself to become responsible members of society. I want to believe that this lecture series is going to provide you with bodies of knowledge and ideas that you can explore to better yourself. I want to wish you a very successful deliberations with the hope that at the end of the day, we are going to have positive outcomes as a result of this lecture series. So on behalf of the Vice Chancellor, I will declare this session open, and I wish you the very best. Thank you very much.
Thank you very much, Vice Chancellor, sir. Can we please put our hands together for the Vice Chancellor? And distinguished ladies and gentlemen, now we are coming to one of the main agenda of the day. At this point, I'll hand over the proceedings of the lecture to the chairperson of today's occasion, Professor Bola Adeyanjo, set the rules and then guide the presenters on how to navigate through the presentation. Thank you.
Thank you very much, the MC. We look at our program here. The next thing, the presentation, our keynote speaker, Dr. Ladan. Dr. Ladan is giving us knowledge about career opportunities in kinetics and health education. Briefly, let me tell you that Dr. Ladan also graduated from So, just in summary or briefly, he was also a student of PhD in those days, but now human kinetics and health education. Please, the MC kindly give us a brief summary of his citation. Thank you.
The chairperson, Ma, with your permission, may I please call on Dr. Ladan to please rise and remain standing while. Citation of Dr. Mohammed Sani Ladan, PhD, Director, FCT Secondary Education Board, Abuja, Nigeria. He is a distinguished educationist, policy strategist, leadership icon in African education. Dr. Mohammed Sani Ladan stands as one of the Nigeria's most accomplished and visionary leaders in the education sector. With an illustrious career that spans over 4 decades, he has devoted his life to the advancement of secondary education in Nigeria, transforming institutions, empowering educators, and impacting generations of life through his leadership, scholarship, and advocacy. Born with a passion for learning and community development, Dr. Ladan pursued a lifelong academic and professional journey that culminated into the attainment of a Doctor of Philosophy, PhD in education. His scholarly depth, coupled with a pragmatic understanding of the Nigerian educational landscape, positioned him as a thought leader and administrator of national repute. Dr. Ladan is a prolific participant in both national and international education platforms. He has represented Nigeria in numerous global education summit and training programs, which include the International Leadership Conference in China, the Global Education Leaders Conference in United Kingdom, the Pan-African Educational Forum in South Africa, Policy and Curriculum Development Forums in Finland, Kenya, and various West African countries. He is a fellow of the African Principals Conference, a testament to his enduring commitment to professional development school leadership. In recognition of his selfless service and exceptional contributions to education and national development, Dr. Ladan has received several prestigious award honors, including an African Icon of Public Service Renaissance Award, United Nations International Peace Medal, Most Patriotic African Technocrat Award. Nigeria and the African continent confront pressing challenges in access, quality, and equity in education. Dr. Mohammed Sani Ladan remains a beacon of hope and a source of progressive ideas. His contributions transcend mere policy. He touched lives of the students, teachers, school administrators, and policymakers alike. Dr. Ladan continues to dedicate his expertise, energy, and vision to shaping a more inclusive, innovative, and future-ready educational system for Nigeria. His legacy is one of transformation, integrity, and excellence. the Chairperson Ma, the Vice Chancellor, distinguished guests, members of the high table, I present you one of our guests for today, the Director of FCT Secondary Education for Abuja, Dr. Mohammed Saniladen. Please let's put our hands together.
Wow. The Vice Chancellor, ably represented by the DVC administration, or academics, sorry, my lecturer, and one of my mentors in school. Amiable professors who I cherish most. They made me what I am, and I will not forget you. My distinguished other members of the responsibility table, I want to sincerely appreciate 3 key professors here whom really worked, motivated me, mentored me, and above all, encouraged me. You know, as a student, sometimes you'll be fed up. At the time I wanted to go, my mother said, come back, you're not going anywhere. And that is why I want to use this opportunity, and I won't let it go. I want to sincerely appreciate the person of this occasion, Professor Mrs. Florence Adeju, alongside Professor Mrs. Suleiman. I won't forget Professor Gwani, who really inspired me and made me who I am today. Forget about the citation and what I do, because sometimes when I'm flattered, I become confused when I want to talk because of all the things they have mentioned. Our esteemed students, we were once like you before, and here we are today, answering them, directors, secretaries, and all what have you, because of our dedication and commitment, and above all, loyalty. I was happy when they mentioned HOD and the rousing applause and what have you. That means the department is still working. Can we appreciate them, please? Well, I'm here this morning, just as he mentioned, I just came back from China last week. And because of the importance of this gathering, I'm supposed to be resting somewhere. If you notice, I'm using stick to support myself because of the long journey. But I said, I must be here. And here I am today. And I'm going to talk to you on human kinetics and health education, Foundation for National Development and Personal Well-being. I want to start by saying the growing challenges of sedentary lifestyle, which is characterized by prolonged period of inactivities, such as sitting, lying down, and inactive movement. Diseases and mental health issues have made human kinetics and health education very vital. These fields not only promote physical activities, but also support preventive health care and mental well-being of people. In Nigeria, where health and youth issues are pressing, they offer practical solutions beyond sports and classroom by empowering professionals to improve public health and community wellness. Ultimately, they serve as tools for shaping individual growth and national development and informed health policies. This is to say, human kinetics and health education play a vital role in shaping total overall being of an individual. You know, in those days, we trek 1.5 kilometers to go to school. But nowadays, our children are so lazy that from house to the school, they must look for support, Okada. Send a child to the market to climb Okada. Instead of assisting or exercising himself while taking the movement, you always look for the simplest way of carrying out activities. In those days when we were here, we trek all around the compound. But still, what is happening now? It is bike everywhere. From faculty of education to engineering, you must climb bike instead of exercising yourself. So that makes human kinetics and health education to find solution for this kind of problems. We have to come back to the drawing board. Now, to understand this better, I try to simplify the paper. What is human kinetics? In a nutshell, human kinetics is the study of movement. Scientific study of human movement, physical activities, and performance. And we of that which studies how the body responds and adapts to physical activities, training, and exercises. Sports science focuses on performance improvement, injury prevention, and recovery in sports, while fitness and wellness emphasize the importance of regular physical activities and health habits for overall well-being of an individual. And coming on to health education. What is health? Health is a complete state of physical, mental, and social well-being, not just mere absence of sickness or disease. That's a plain definition of health. And for you to be healthy, you have to be physically, mentally, that is your thinking ability, and how to respond to situation. And then the social well-being, how do you interact positively with other people and performing your duty. Now, if you add education to it, it is a process of educating people about health. And under it, we have health literacy, which empowers individuals and communities with knowledge to make informed health decisions. Then disease prevention focuses on preventing illness through education on topics like hygiene, vaccination, and nutrition. While mental and emotional health encourages awareness and management of stress, emotions, mental well-being of an individual. What is the importance of human kinetics and health education? Let's look at the importance of human kinetics and health education. Firstly, one of the importance is holistic development. It develops the physical, mental, and emotional aspect of individual for balanced personal growth. That is, for balanced personal growth, you must be active. And then professional training, which prepares students for career in education, sports, therapy, fitness, and health services. That is why we are here. Professional training, to be educated, to be well schooled, and have the skills to carry out your functions effectively. Then the productivity enhancement. A fit population is more energetic, focused, and productive, positively affecting national output. That is to say, if a nation is, all the population of a nation are physically fit, then you will discover that we'll be more energetic, we'll be more focused, and productive. Just as I mentioned, I just came back from China. You cannot see a lazy man in China. All of them are very active and very productive, no matter the age group. We have a lot of physical training centers in all these centers or all the province you visited. There's activities for the aged, there's activities for the young. In the morning you will see them. All of them will come out training based on their age status. That we are making the country more energetic and focused. That's why you see them very active and very focused, because they normally engage in physical training and physical activities within the province they are. And then cost reduction in healthcare. If the nation or the nation is healthy, there will be cost reduction, definitely in healthcare, because we visit the hospital, it's not the ill or the sick person. And if there's a provision where everybody is active, then only few people that will be seen attending hospital. Now, what is the relevance of health education and human kinetics to national development? First, healthy citizens, strong nation, just as I mentioned. If the citizens are very healthy, then the nation will stand strong. A physically and mentally healthy population support workforce, productivity, and national growth. Once a nation and the citizens are strong, then they will support the workforce, because everybody there is engaged in one thing or the other to contribute positively to the development of the nation. We don't have an idle mind there. Everybody has his own contribution to make towards the development of the nation. And then, just as I mentioned, we reduced healthcare burden. With proper education and fitness, hospitals and clinic decrease. The demand on hospitals and clinic line or decrease, because everybody is fit, so nobody will go to the hospital. Or what? You know what to do at the right time. Then employment opportunity, that is where we are. It creates jobs in coaching, fitness centers, therapy, education, and public health campaigns. These are career opportunities. You can take coaching, you can take physical fitness centers. We have very plenty spread all over. And then therapy. Where I attend my therapy, I ask the boys there whether they have certificates. Out of 5 of them, only 1 have a certificate. Others are apprentices, looking at what he's doing and then repeating after him or duplicating it. And then public health campaigns, which the HOD mentioned, that students of public health correctional centers in every care homes and what have you. All we are doing in order to make sure that we have a free society and e-health community, so that by following the rules and regulations on how to live. And then we go to youth empowerment. That is engaging youth in sports and health activities, reduce social vices, and channel energy into positive outcomes. Engaging on meaningful physical activities and campaigning and outreach, we are reducing social vices. Social vices in the sense that they said that idle mind workshop. You will not have time to start thinking negatively, and you will always be thinking a positive way. Now, moving on, human kinetics and technology, because we move with time and technology. There are a lot of hardwares that are associated with this. We have wearables. Devices like smartwatches monitor steps, heart rate, sleep, more helpful in personal and professional settings. We have smartwatches now, devices that can monitor your heart rate, regulate your blood sugar, and what have you. We should move with 21st century. Now we have AI and analytics. AI is artificial intelligence used to assess athletics performance, prevent injury, and personalize human plans. This AI, some of them are taking over our responsibility. Even at the gym, we discover robots are taking up some of these functions and activities. They train real athletes, and they are not human beings. They are programmed, and they perform their duty effectively. And then we have online coaching, which allow instructors to train clients remotely and reach rural or distance issues. With the use of technology, you can give instruction or train online. Once your client knows the time, then he can hook up and link up with you. And whatever you do, participate and train. Then we have physical fitness applications, which provide routine diet plan and tracking tools that promote self-guidance and wellness. The fitness applications that really guide human. Now coming to our main thing, career paths in human kinetics. First, we have public health officers. Designing, their work is to design leading awareness program to improve public health, just as you are doing your outreach. Exercise physiotherapists. They design fitness programs for health improvement. Sports science, conducting research to improve athletes' performance. And then the lecturing work of researcher, teaches in the university or conduct studies on human movements, as we have in the department. And then fitness training or trainer and wellness coach trains individual or group in gymnastics or corporate setting in an organization or community. And then fitness consultant, they are the one offering personalized fitness and wellness plan for individuals. And then we have sport administrators, managing sports. Their work is to manage sports organization, clubs, or government sports initiatives. And then we have professional athletes, like footballers, runners, basketballers, basketball players, boxing, wrestling, and to mention a few. Then we have sports journalists, broadcasters, global sporting news, e.g., for example, the China sport and super sport. These are all professions that you can embark on. Now, I want to take you up to, let's see, success stories from Nigeria. First is Dr. Daniel Igali, Nigerian-born Olympic gold medalist, wrestler representing Canada. Studied human kinetics in Canada, went from a rural Nigeria to Olympic gold medal. Later become a university lecturer, served as a commissioner for youth and sport in Bayelsa State, promoting physical education and youth development. Another good example is Dr. Sunday Ogochukwu Olise, former captain of the Super Eagles and professional footballer in Europe, holds a diploma in coaching and human kinetics, managed the Nigerian national team, and has spoken on the importance of structured physical development and training. And another female athlete called Chioma Ajunwa Opara, a former Nigerian track and field athlete and Olympic gold medalist in long jump. She studied physical and health education. First Nigerian and African woman win Olympic gold medal in field event in Atlanta, 1996. Later became a police officer and advocate for youth empowerment through sports. We have another one again called Blessing Okapara, Nigerian Olympic Commonwealth Games medalist in sprint and long jump, studied human kinetics at Delta State University, used her academic background and international exposure to become a role model for Nigerian youth in sports, promoting discipline and education in athletes. Then, all these are Nigerians that have explored and became something else in the field of sports. Now let us see, what are the challenges that is making us not to move fast and then do something? Number one, inadequate infrastructure. Lack of modern facilities and equipment in schools and communities. Most of these facilities, the modern facilities, are lacking. I don't know of now, but if you visit, and so many opportunities that we have that others, and so many opportunities that we have that other departments don't have. And then lack of career awareness. Students and parents don't understand the wide range of professional paths available. We have to shout, and we have to expose ourselves, and then we have to talk to ourselves. And then poor curriculum integration is another factor. Physical education is often undervalued in school system and may be inconsistently taught because of that issue. Now, what is the role of university in this regard? Number one, skill development. We have to equip our students with practicals and theoretical knowledge for their future career, which we are doing now. Research and innovation encourages students in biomechanics, therapy, sport medicine, and community health. We go a long way. Cross-disciplinary collaboration. We have to collaborate with other departments and other agencies to make run outreach programs, sports clinics, and health screening to serve local population. And then global readiness. Prepare graduates to meet international standards and pursue advanced training and employment abroad. When you do exchange program, like the department I hold We do exchange program, and that is why we travel a lot. We are linked up with so many universities outside there, where our students are invited to come and see what is happening, how they run their program, and most importantly, and this entrepreneurship education. That is what we do. That is why sometimes you will see us traveling up and down, that students are well groomed and prepared for their future. And what students should focus on this our program, and interdisciplinary learning. You have to embrace ICT, entrepreneurship, and psychology alongside your core courses. You have to be ICT compliance, because we are moving to this level. That's for NGOs to build your skills. When I went to China, I now understand that we have a course called volunteer. These are a group of students that assist visitors. Anywhere you go, they are there as volunteers. And when they see you moody, they will come to you, they will be telling you the history of the province you visit, what you are expecting, or what you are expected to see, and encourage you in your own language, both French, English, all the languages you can think of. We have volunteers on them. And as soon as you arrive, this guide will continue to follow you and guide you. If you don't understand their language, they will interpret for you. And anywhere you go, they give you the details of what is happening there. And thereby, that is what they studied in school. And then soft skill, communication, leadership, adaptability, and teamwork are essential in both health and sports career. You have to have, even if it's not a depth skill, it's a referral skill and adaptive part must be there and have. Then stay informed as a student. Follow health and fitness trends. Attend workshops, which we are doing. Take online courses to remain relevant. If you want to remain relevant, you have to stay informed. Always be in touch. What is the latest and what is the innovative aspect of whatever you are doing. Then postgraduate studies. Consider further training, certification, e.g. first aid, fitness training, or master's degree in advance to advance your career, which is very important. Ladies and gentlemen, conclusively, human kinetics and health education is a powerful discipline for personal growth and national transformation. Whether in school, community, clinic, or tech industry, your knowledge and skills create real impact in people. As students and future professionals, embrace your role. You are more than athletes or educators. You are a health champion, innovators, and national builders. I prefer some recommendations which, if followed, there will be great improvement. That is, 1, improve sports facilities. Invest in quality sports and fitness infrastructure in schools and community through public and private partnership. Just as I mentioned, I always refer to my journey. In Switzerland, most of the community I visited, but they are bordered with France, Netherlands, Italy, and what have you. All these borders, when you visit them, there are sports centers, because most of the workers in Switzerland come from these provinces. So they have what they call province sports centers. That when you finish your day work, when you come back, you go there and relax. Physical fitness, ability to perform one's work well, and still have some reserve energy to perform extra work. That is how it is. Train and upskill educators. Provide ongoing training and certification for educators to stay current with global trends and best practice. And then enforce supportive policies. Implement and fund educational policies that prioritize physical education at all levels of learning. That would go a long way. And then increase funding, because nothing can happen if there is no money. Money should be made available. Allocate more government and donor funding to human kinetics programs, research, and infrastructure. Once that one is done, a very fit society will be created. Promote research and innovation. Support students for studies and innovative programs in areas like sports science, wellness, and biomechanics. When we invest on this and got the modern facilities that will facilitate good develop our skills and good mental health will go a long way. And then use of digital tools. I mentioned that we're in the digital age now. Whatever is happening, you have to be ICT compliance. Integrate technology such as fitness app, e-learning platform, and wearable modernized learning. Distinguished ladies and gentlemen, I want to thank you for hearing, and God bless you. Thank you so very much.
Dr. Sani Ladan, we appreciate the knowledge that you have presented to all of us, the students and those of us up here. We appreciate you. Out is a unique profession, and so with all the knowledge, even Professor Sani Ladan, you can go on and use the knowledge to benefit yourself and the nation entirely. So once more, we appreciate you, Dr. Sani Ladan. You have given back to where you got it to. So thank you so much. So the next thing on our program now, interlude.
And the interlude is to be led by Coach Emmanuel. The interlude is a performance by the student of Human Kinetics and Health Education. All works without play, the same extract for all boy. All works without play, they say. All works without play. So let's play a little. Coach Ima. Coach Ima, you have 5 minutes, please. Thank you. Thank you very much. Thank you very much. After the second presentation, there's going to be another performance. But before that, ladies and gentlemen, quickly, given the tight schedules of the Vice Chancellor, the Vice Chancellor wished you well, and he has asked me to plead with you that you will want to take his leave now and attend to other university pressing issues. But before we do,
for second. It's supposed to be used. Hello, everyone. Hello. Okay, we have to move on now. So we want to have the second presentation by Dr. Yusuf Yakubu. So we will have a brief citation of Dr. Yusuf. That one. Let us leave that one first. So thank you very much. I think the MC will pronounce the name better.
Thank you very much, Prof. Ma. Quickly, before the citation, may I acknowledge the presence of, as a way of moral support, the president of the Student Apex Body, talking about the Student Representative Council, Omrid Nazir Ibrahim Kalla, is here to support the Department of Human Kinetics and Health Education. You're welcome, Mr. President. With your permission, Ma, may I humbly and respectfully request that Dr. Yusuf Yakubu Ariga CU stand and please remain standing while I take the citation. Dr. Yusuf Yakubu Ariga CU is a distinguished public health expert, health educator, and a civil society activist, born and raised in Rikasa, Igabi local government area of Kaduna State, Nigeria. With over 30 years of experience in public health and primary health care management, Dr. Ariga CU has made significant contributions to both academic and professional spheres. His career began at the Primary Healthcare Department of Igabi Local Government, where he served as an environmental health officer and rose to the position of Assistant Chief Health Educator. Notably, he was recorded as the first graduate among primary healthcare workers in the entire local government service of Kaduna State. As a health educator, Dr. Ariga CU has taught in various institutions, including the Islamia Medical Foundation, School of Health Technology, and Shehu Idris College of Health Sciences and Technology, both in Tidongwada, Kaduna, where he served as a visiting lecturer. He later transitioned fully into academia as a lecturer in the primary healthcare tutors program of the College of Vocational and Technical Polytechnic. Dr. Ariga CU has collaborated with several international organizations. He was the first and also worked Hopkins University Center for. Additionally, served as a research assistant with Family Health, London, and managed several donor-funded programs through organizations like PACT Nigeria and USAID. His leadership roles included serving as provost of Shehu Idris College of Health Sciences and Technology, Agarfi, Kaduna State, the pioneer dean of the School of Health Sciences and Technology, Kaduna Polytechnic, director of Policy and Transparency Division at Kaduna Polytechnic, executive secretary of the Kaduna State Pilgrims Welfare Agency, where he was awarded as the best and most dedicated executive secretary among the 36 state pilgrims in Nigeria, including Abuja. He currently serves as the managing director of the Kaduna State Environmental Protection Agency. And he is the author of several works, including Emerging Issues in Primary Healthcare Management and Introduction to Environmental Health, in addition to publishing numerous academic journal articles. Dr. Ariga CU has traveled extensively for professional and academic engagement in countries such as the United States, South Africa, Ethiopia, Morocco, Ghana, Niger Republic, Saudi Arabia, Oman, among others. He is a member of multiple professional associations, including the Chartered Institute of Environmental Health London, the Les Aspin Center for Government ESE, and several others. The chairperson, Ma, the vice chancellor, distinguished guest members of the high table, I present to you our second speaker of today, Dr. Yusuf Yakubu Ariga CU. Please, let's put our hands together for the second speaker while he comes for the presentation.
The chairperson, the vice chancellor, Bello University, Zaria, the guest speaker, other distinguished members present here, my colleague students, Good afternoon, or morning, when I'm here. So let me just say good afternoon. I was asked to join second lecture series for Department of Kinetics, Human Kinetics and Health Education and Promotion to contribute in the discussions that affects the career talks for our students. And of course, even those other parents that are still thinking of whether or not their children should be part of this notable profession. I wanted to, with all humility, use my CV as a career guide for the current students. But I find it very difficult to do that because I don't want to do like the Americans do when they blow their trumpets. They blow their trumpets so much. You don't give them opportunity to speak. But I think I also want to deviate from my senior colleague who was taking his time to give definitions of human kinetics, health education, and what have you. I think that definition is enough for all of us. I don't need to repeat what he said. But like I always tell students and myself that the definition we are given to ourselves, particularly the one that was made by WHO, which becomes obligatory to use, but not all of us accepting it, has been presented by our senior colleague. And I want to remain there, and that is all. Ladies and gentlemen, I want to appreciate whoever was opportune to gain admission or is currently studying health education and promotion. Congratulations to all of you. Congratulations to all of you. Congratulations to all of you. I was in your shoe when I got admission to study health education. Before I tell you where, as been said here, my wife graduated from this university. We always had query. They were telling me that AB, what did you call? AB student is nationally. ABU and any other university. ABU first, then other university. I said, no. I said, we have only one University of Nigeria in Nigeria. So when I got admission to go and study health education in the University of Nigeria, in Nsukka, I was asking myself, what is the fate of my program after graduation? Like our elder brother here said, the question is, when you say you want to study health education, because the name is being attached with physical and health education, but the thinking is you are the how to biology. So what is the importance of that program? Even parents themselves, usually because people, the children and their parents want to know the future of their children if they graduate from what they are studying. Like our elder brother here said. So I have to make some findings, but I could not get actual answer I want. I registered, and luckily there was what is called tutorship and mentorship programs in the university, where our elders meet us to discuss with us what that course is all about. And I hope ABU is also doing that in this department. Otherwise, our students will be left with questions. What will be their fate after they graduate from this program? And that is why sometimes you find admission, the department will lack admission request from people who ought to be in the department. So, health education is a very important program, a vital field that promotes well-being by educating individuals, families, and communities about healthy lifestyle, disease prevention, and healthcare practices. As a public health practitioner, globally, because there wouldn't be public health if there's no health education. Public health depends solely 70% on health education program activities. So whoever is talking about public health is indirectly talking about health education. And this field is highly demanded in the whole world. And that is why I appreciate our former speaker who talks about, IT, being friendly to IT, internet. If you don't do that, you won't understand what's happening in the world. You are within your local vicinity and you'll be thinking about what will I do after I graduate from this program. Let me tell you that one, in public sector, when you graduate as a health educator, you have health educators play roles in the government, assistant chief health educator in the local government. These are also health educators who study health education. Also have community health advisors are also those that also study health education. So you can see in public health sector, you have vast area where you can be employed when you graduate. There's also program coordinators. Like they said in my CV, I was a Gavi consultant. It's a program. I work with John Hopkins American Center for Communication. It's a program. I work with Family Health London. It's a program. I work with several NGOs, international NGOs. All this is programs. As health educators, you can fit there very well and work with them. Depends on your capacity and ability to initiate and understand it very easily. So, then,
Bluetooth is ready for pairing.
National primary health care are there in all states of Nigeria and Abuja are ready to employ you. Local government health departments are there to employ you.
Bluetooth has been connected.
Health educators are employed in clinical settings to promote patient education and wellness programs, like our brother said. So, these are some of the places that when you finish, you are good, you are employable, you can be employed. Because you can graduate and you're not employable, unfortunately. So if you graduate and you are employable, you can be employed there. There is also the roles of public patient educator. Like you mentioned here, somebody who undergoes therapy. He's dealing, you need somebody to educate him right away, to tell him what the do's and the don'ts. This can be done only by health educator. Let me give one example before we continue. One day I took students to one of the hospitals in Kaduna, so I don't want to mention the name of the hospital. And I saw, I'm sorry, the nurses, I'm sorry. I saw a nurse midwife, educating pregnant women during antenatal program. And she was saying to them, if you go home, tell your husbands that he must give you, provide for you, meat. And then she turned her hand like this. You hold her hand like this, as big as my hand. So I was sitting down close to her, listening to her and the student. I was confused. I was tense. I was shivering. Do you know why? I know how my people respect the words of the health workers. She will go back home and tell her husband that Dr. Yachi, Likita Yachi, Abani Nama, Jibgiji Kamaka. And believe me, if that man could not provide what the doctor says, that could end the marriage because she will say, don't take care of her. The doctor said this and that body issues. Then I was taking as an example to my students. I said, look, for health educators, they know how to present this issue without actually creating problem. We will think of alternatives. Why do we need to eat meat? Why do a pregnant woman need meat? Health educator, because experience, has the knowledge, he will look at her status, look at where she comes from, and then give alternatives. You even said, madam, if you can have crayfish, you don't take protein, you have crayfish, you can have fish. Then 5 naira at that time. Today, 15 naira can buy you, I don't know, but it can buy you crayfish. I don't know. So it can buy you crayfish, okay? But it's more cheaper. It's more cheaper than a big meat as described by this word, nurse. So what I'm trying to say is that you have alternative of source of your protein. This was supposed to be done by you. So this is specifically for those people who understand health education. They know the method, the ways and manner to deliver their health talks when they're dealing with patients. So there are specific health education that has been done by health educators. There's also academic training, academics and training institutions. Of course, some of your professors here, some of your lecturers here graduated as health educators, and they were opportunity to also be employed to come here and become teachers of health educators. So you can also graduate and go to any school of health technology, go to any university that offers health education and teach. So you have a career as a teacher if you're interested to become a teacher. There, you can even become an expert in curriculum development. I know a colleague who was not employed by government, was employed by international organizations, but now on his own. All that he does is to develop curriculum on health education for international organizations or government, and that's what sustains him up to now. We have come together with him, but unfortunately he has traveled. We always look for money. We also have school health coordinators. We have school health coordinators where they are employed specifically to give health education activities. We also have training consultants. As you are looking at me here, one of the way of my sustainability is to conduct trainings. And I do my trainings within Nigeria and outside Nigeria as health educator. So you have ample opportunities to travel, to go and crannies to deliver, if you can use your initiatives, if you can use your own ability and capacity. Not just because you graduate as an educator will not make you to have all this. You have to make a good initiative. You have to think faster and read wide and make contacts and connections. You can also be a teacher in career roles, behavioral change communication officers. These people are also health educators. Behavioral change communications officers are health educators. I remembered, because of this opportunity, in 2002, when I was Gavi consultant, there were high rejection of polio in Nigeria, particularly in northern Nigeria. There were people in ABU that were antagonizing us. But because of this program, behavioral change communication, many people today accepted polio. In fact, just 3 days ago, I was making just of one woman, who was so antagonistic of polio. Now, her daughter grew up, she married her outside, and she had 3 kids. And I was saying, Hajia, why didn't that polio stop your daughter from getting children? And you said it's infertility pills you are giving to your children. Now, because of the program and the activity we design, people gradually start to accept, polio. So there are NGOs outside there that are ready to employ you as behavioral change communication. There are also capacity building specialists in healthcare programs. There are also monitoring, evaluation, and learning officers. All these things you need to add to your knowledge to learn and then give you opportunity to do what you're going to do. There's also local NGOs, they are there, international NGOs, Red Cross, Save the Children, they are there, UNICEF, they are there. All they have space for you if you have the capacity to pass their interviews and what have you. There's also media and communication. Media and communication. Most today, some of them don't employ us. They employ some people to go and read and then stop. Otherwise, the reality is that they employ health educators to work on health issues, to speak on health issues. I know of one of them, Mrs. Benga, which was health graduate, I think from ABU too. I'm not sure, ABU, that was working with me. She was one that used to design our radio messages on health programs. Because there are, like I said, there are things that you make mention, it can cause fire. But health educators are trained to know where to start, what to do, and how to end it. So these are some of the programs that if you are a graduate of health education, you can be able to get that. There's also what we call health journalist or broadcaster. After your program, you can go for a 3-month program. It's online, like Jonathan said, there are online programs. You can go and be specialized in journalism, health education, health journalism. Okay, you can specialize on that 3 months. Just Google and you'll see it. Health journalist or journalism or broadcaster. So that when you are making news, when you are writing, you write as a professional. There are terminologies that are not clearly understood by some people that are not among us. So when you are a professional, you write as an authority. And also there's also content developers in the TV, radio, and social media. I used to sympathize with some of us that will stay and say that they want even employment. As an educator, the only thing you need to add is how do I write proposals? How do I know how to write reports? Proposal. You don't need government employment. You don't need government employment. Let me be kind with you. For the past years that I've been in government, I found myself so lazy. So lazy. Because when I was in government, generally speaking, from morning, evening, and night, I'm always been working. You see that you work with this organization for 2 hours only in a day, 1 hour on LD, to do specific things with that organization. And it's through health education, not less. So what I'm trying to say is that please open your mind. Don't only wait for Nigerian employment, local governments. No, try and be internet friendly. In fact, you can even go for training to understand how do you even link yourself with this kind of organizations so that you can be employed while you are at home. Yes, women particularly. Women, there were some of my students that I told them, and we undergo this kind of small training. Some of them are at home now. They don't go to office. They stay at home, but working with their computer or laptops at home. They work, give report, write, and what have you, and they get their pay. Go there, you will see it. I'm just telling you, I'm just giving you an insight. We also have health campaign managers. They can employ as health campaign managers. There are a lot of campaigns now. Before there were HIV, there were Ebola, there were a lot of diseases, conditions, a lot of issues that if you, through those internet-friendly programs, you can employ you and you can be one of them. And a lot of things there. And there is online health platforms that you can also even use yourself and work for it. There's also corporate sector. Some companies hire health educators to improve employee wellness and occupational health, like he rightly said here. Some organizations, in fact, as I'm talking to you now, one of the companies contacted us, and I sent somebody, because I cannot do it, to go to that company in Kaduna to educate their staff and ensure they are health friendly in their own company, because sometimes they come to CAPA because we used to go to them and ensure they comply with certain occupational standards. And one of it is that their staff must undergo medical examination every 6 months, maximum every annually. There's also tests that you have to do that your staff what we call placement checks, where some places you cannot work in some places, you can work in some places. So this is what some of them they do, so that inshallah, I'll stop now. So there is also this workplaces, coordinator, occupational health educator, health and safety officer, corporate authorities. There are a lot of things that you can do in industries where, if necessary. Then, so close to the last one, research and policy. Health educators contribute evidence generation and policy development. You can assist. I did health research assistant with Family Health International London. I started with, we conduct a lot of research. From there, I become a research officer. You can do that after your graduation, and you will enjoy getting what can take care of yourself. Then we have policy analysis. Health educator as a policy analyst, data analyst, health promotion, research assistant or coordinator, employer, health institute can employ you, universities can employ you, health policy think tanks can employ you, development partners can also employ you. And then the last one is entrepreneurship and consulting, where qualified health educators can start their own initiatives or work as consultants. You as a graduate, the only thing you need just small push. You can start as a consultant. I have my farm. I have my consultative firm where I conduct research. I employ people for health talks, where we do a lot of things when we are hired to do it. So you can do that as a educator. Don't just close your eyes and mouth and face on government employment only. I'm sorry. Then let me go finalize. The most important thing for you as an educator, you must learn how to do public speaking in your language, in Hausa. If you are Igbo, in Igbo. If you are Yoruba, in Yoruba. And then, of course, even the pidgin. The big grammars we play sometimes in universities, in our classroom, it's not sometimes useful in outside the classroom. We use, most will tell you that they want somebody who understands the local language. If there is issue, for instance, like issue of reproductive health, family planning, or what we call child spacing, they will prefer somebody who understands the culture, understand the language of those people that will speak to them the way they will understand. So in health education, we don't mind big grammars. What we are after is how do we communicate to people to understand? Not to speak English and people say, this man is a dictionary. I have somebody who spoke one day. We're talking, we're in a conference like this, and then the Sultan of Sokoto said something. He said, Wani, I listened to your English. You know, my problem is with you is that whenever you are speaking English, I have to hold my dictionary close to me before I understand what you are saying. And people were clapping their hands. As educators, I know it's an insult. It means that you are talking, you are speaking, and those people you are speaking to them, they don't understand what you are saying. They need to refer your grammar to dictionary before they understand. It is useless. In health education, you must understand. If you are Yoruba in Kaduna, in the north, try to understand Hausa. If you are Igbo in Kaduna, try to understand Hausa. If you are Hausa in Igbo land, try to understand Igbo. This was one. When somebody understands that you understand his language, you understand his culture, listen to you very well and grab what you want to tell him easily. So the issue is that health education is a dynamic and versatile field with career opportunities in public health, in education, in media, in research, and private enterprise, with growing attention to preventive health and wellness globally. Health educators are more needed than ever to shape healthier community in Nigeria and the world at large. Thank you. With the permission of the chair, I was directed to hand over this award to one of the students here, Sadiq Uzori Behi Abdul Basit. Before I left, I'm sorry for putting the call. I said there is a professional education for health promotion, a Corodays Award of Excellence in Health Education and Promotion. Thank you, sir. Thank you, sir.
Yes. No. And house. Okay, thank you so much for this beautiful presentation. Dr. Yusuf Yakubu Arigasiyu. At least I've been able to. That's it. Thank you so much. God bless you. I will have the second interview students. Over to you.
Making sure no matter I need a shot to become the sum of the man. I'm not pass. I am again. I'm not pass. I'm just a lot. I'm happy family.
Guests. First of all, I would like to call on the Commandant NSE See, please, your goodwill message.
الله أكبر الله أكبر الله أكبر الحمد لله الذي بيده ملكوت كل شيء وهي لا إله عليه. Alhamdulillah. The Vice Chancellor The Vice Chancellor represented by the Deputy Vice Chancellor Academics, Raymond Bago, other invited guests, the staff and students here present, permit me to stand on the existing protocol. I'm so delighted to be here standing in for my Commandant General, Professor Ahmed Abubakar Audi, who is unavoidably absent. Hope it is not only the students that will enjoy these lectures, but even we adults. Which is very important to our life in general. Human kinetics is rich as the whole vitamins in the body. At this juncture, I would like to say I wish you the best of luck, and thank you so much.
Thank you very much, sir. Please, can we once again put our hands together for the Commandant of the NSCDC, Kaduna Command, Corps Marshal Bello Nuhu Dansadeo. I'm sorry, thank you very much, sir. And the next, ladies and gentlemen, for the goodwill message, may I invite Major M. Musa, who is here representing the Commandant of the Army School of Physical Training, Depot, Nigerian Army.
Thank you very much. Thank you very much. Thank you very much. The chairperson, our mother, Professor Mrs. Ebby Adeju, my fathers here present, please permit me to stand on already established protocol. I'm also a son in this home. I'm also a student this great university as far back as 2000 in the same department. So, as said goal, I'm also a benefit or a beneficiary of the physical and health education department. I was called to give a goodwill message. I want to call your attention that even in the armed forces, we have the Directorate of Physical Training. For the Army, Navy, and the Air Force, we have a singular department that is so responsible of the starting with the responsibility of training as well as keeping the officers and men fit in the all armed forces. So you have that as a takeaway anytime you find yourself to be in the system. We also have the Department of Medical, which also offer both health information management, environmental health, and so on, which also open to both physical and health education students. We also serve as a pioneer for the what they call it. We also administer sports in the Army, Navy, and Air Force. So they are all open opportunity for the young men and women that can find themselves in it. Once again, congratulations, and wish you the very best.
Thank you very much. I was expecting you to shout, "Hurrah!" Thank you. And the next, ladies and gentlemen, may I invite the Medical Director, Federal Medical Center, Abuja, Professor Saad Ahmed, who is here ably represented by Professor Abdulaziz Hassan, Deputy Director, Directorate of Academic Planning and Monitoring, Ahmadu Bello University, Zaria.
The Vice Chancellor, Ahmadu Bello University, Zaria, Professor Adamu Ahmed, who was ably represented by the Deputy Vice Chancellor Academy, Professor Raymond Bako, other principal officers of the university present, Dean of Education, who was ably represented by Nuruddin Akorede, our chairman of the occasion and president of NAFA SD, senior members of that department. I may not remember your names individually, but I remember Professor M. Suleiman, Professor A.G. Suleiman, who I met today, and I learned a lot from him. Our distinguished guest speakers who have actually done a remarkable job. In fact, for the students, I would want to say that you are a lucky set of students. This is because it is not every department that organizes this kind of career talk. Because from this career talk, I'm sure some percentage of persons now have already designed in their head that, look, this is what I want to do. And the guest speakers are giving you experience directly from the field, which is something that is very remarkable. So I want you to give a round of applause to your department for organizing this. And Professor Saad Aliu Ahmed, who is the Medical Director of Federal Medical Center, Abuja, was unavoidably absent because he had to travel to the United States for a program. And he directed me that I should make sure that I attend, because he told me that he has a very good link with the department and that he doesn't want to disappoint them and make sure that I come here to represent him. His goodwill is that the students are a key ingredient to the university and for nation building. Like someone said, he graduated here in 1980. I was still in primary school, actually. But today I'm here, and we always learn as the elders leave, the younger ones come up to take the rungs of leadership. So with this, I would like to congratulate all of you once again and thank the department for inviting, and hope that we'll continue to do this career talk
in the future. Thank you very much.
Thank you very much, sir. Can we please once again put our hands together for Professor Saad, ably represented by Professor Abdulaziz Hassan. Now, the chairperson, we call one or two questions. After that, we proceed to the next item. Please, questions and answers. We entertain only 3. One from here, one from this side, and then one up. After that, please, whatever questions you have. Any questions? No question? Then in the absence of any question, the chairperson will move to the next item, which is presentation of the NAFA SD Student Wing magazine. And with your permission, ma'am, may I invite Professor Umar Musa, the former HOD, Department of Human Kinetics and Health Education, for that task.
Thank you very much. The Vice Chancellor, represented by the Deputy Vice Chancellor Admin, Academics Admin, Professor Raymond Bako, my teachers, other colleagues, students, good afternoon. I'm here to make a presentation of the student magazine. But before then, I would like to add a word that has not been added. That the opportunity also is sectors, you have similar sets of opportunity. Thank you for debating a little. This is student magazine. I would have wished to be presented by my auntie, Professor M.A. Suleiman, because of her, I will say, over generosity. However, I will use the opportunity to make the presentation and also its honor using my mouth on her behalf, because I know she will not reject it. We are just one. This is student magazine produced by the NAPA SD wing, which is to be presented here, and we are all aware that money is used to produce this thing. On behalf of my auntie and the department in general, as well as NAWIS, NAPA, she has donated 50,000 for this magazine. And they will always push me in the department that you must copy her. I always said that I cannot in this area. I have the mind, but I don't have the capacity to copy her. So on my as well, the department and my family, I donate 20,000 for the magazine. And I wish the high table, whoever feel he could, to make donation for the progress of the students and the department and the university at large. Thank you.
Thank you very much, sir. And quickly before we proceed, the Commandant of NSCDC has just a brief announcement in 30 seconds, ma'am.
Once again, I forgot to inform you that I am also a product of ABU here. I am Commandant General also. It's a product of ABU here. The President, Katana State Governor, and President, they are all here. So thank you so much. Be the best.
Well,
Excuse me, sir.
as a member, now, before and now, I want to support the students' initiative with the sum of 20,000 naira.
All protocol duly observed. Sir, I want to support on behalf of the Commandant Army School of Physical Training, support the magazine with a total sum of 50,000 naira.
Okay, thank you very much, sirs. Now, ladies and gentlemen, may I call on the President, Student Wing, Ahmadu Bello University, Zaria, NAFAD SD, Comrade Ernest Farouk Adeza, for a brief remarks.
Thank you so much. Thank you so much. Permit me to rest on the already established protocol. On behalf of the Department of Human Kinetics and Health Education, I stand before you with a heart full of gratitude. First, I sincerely thank you to our esteemed resource persons for honoring our invitation and sharing their valuable time, knowledge, and experience with us. Your insights have not only broadened our understanding of vast career opportunities in our field, but also inspired us to pursue our goals with renewed purpose and passion. To our head of department and his team, thank you for your dedication and support in making this career day a success. Your efforts behind the scene are deeply appreciated. To my fellow students and attendees, thank you for your active participation. Let us take what we have learned here today and use it to shape a stronger, healthier future through the work we do. Once again, thank you all, and may this be the beginning of many more fruitful engagements in our professional journey. Thank you, and God bless you all.
Thank you very much, Mr. Farouk. Again, back to Commandant.
On behalf of my Commandant General, Professor Ahmadu Audi, and the State Commander of Nigerian Security and Civil Defense Corps, we donate 100,000 for 2 months.
Thank you very much, Commandant, sir. Thank you very much, sir. And quickly, ladies and gentlemen, the chairperson, ma, with your permission, may I invite Professor J.A. Gwani for the vote of thanks.
The chairperson of this occasion, distinguished ladies and gentlemen on the high table, my job is a very simple task, and the task is to say thank you. We want to thank the lead paper presenters, Dr. Mohammed Tani